good morning, everyone. I am Dr. Priyanka Oak. I am from Apollo Ayurveda, and today we will be talking about management of infertility after IVF failure through Ayurveda. So, let me share my screen and I would like to brief you all about our organization. Kindly let me know if my screen is visible. Is my screen visible?
Yes, doctor.
All right. All right. So I would like to give a brief introduction about our organization. As you all know, Apollo Ayurveda is a chain of Ayurveda hospitals, leader in quality systems driven Ayurveda medical care that focuses on the root cause diagnosis and management of serious chronic diseases. The organization was founded in 2005, and since then we have treated over 3 lakh patients till date, employing an end-to-end protocols-driven classical Ayurveda approach to address a diverse range of healthcare needs. We cover medical specialties ranging from neurology, orthopedics, and metabolic disorders to respiratory issues, gynecology, pediatrics, dermatology, and beyond. Our approach seamlessly integrates the time-tested practices of classical Ayurveda Chikitsa, that is medical management, with contemporary medical methodologies, ensuring the delivery of well-aligned and effective medical interventions. So currently, Ayurveda operates in Bangalore, Delhi NCR, Kochi, Chennai, and Almora with 8 operational centers. We have excellent facilities and we're complemented by exceptional team of experienced, highly qualified physicians and Ayurveda nurses trained in accordance with NABH standards. Our team includes MD Ayurveda qualified physicians from leading institutes of higher learning in Ayurveda. Which brings us to today's speaker, that is Dr. Swetha. A brief introduction about Dr. Swetha is Dr. Swetha is lead consultant in Ayurveda's Stri Rog and Prasuti Tantra, that is gynecology, department at Ayurveda at Aster CMI, Bangalore. Dr. Swetha has over 18 years of vast clinical experience and expertise in infertility management. She's an exclusively trained Ayurveda and Panchakarma physician, and she heads the integrative fertility care programs at Ayurveda. We welcome you, Dr. Swetha, to today's session.
Thank you, Dr. Priyanka. It's my pleasure to be a part of this discussion, which is a very, very important topic for the day. So Ayurveda management of infertility after IVF failure. I would say, why are we only focusing at IVF failures? I would say we also support, Ayurveda also supports and enhances the success rates of IVF. So this is the question in many minds. I'm sure many of the out there would be thinking, can Ayurveda support IVF? Yes, Ayurveda can support and enhance the success rates of IVF, and also can be scope for the people who have had failures in IVF, where Ayurveda can promote and enhance the fertility chances.
Definitely, ma'am. And we can't wait for you to start the session. I would just like to inform all the attendees, all the participants, that you all can avail one consultation, complimentary consultation with Dr. Swetha, and the details shall be shared with you in the chat box. Other than that, during the session, if you have any questions, any doubts, you can just put them in the question answer box here. If you can see right next to the chat box, all the questions will be taken after the session, and I'm sure we will be able to address all the questions in due time. So, ma'am, without any further ado, we would like to start the session. Over to you, Dr. Swetha.
Thank you, Dr. Priyanka. You able to see my screen?
Yes, ma'am.
The screen is visible, right?
Yes, ma'am.
Good morning, everybody, and welcome to the session. I'm working as a medical superintendent at Ayurveda hospitals at Aster CMI, where we do a lot of integrative approach for the gynecology as well as the infertility specific area. So today, when we thought of having this webinar, the topic was very apt because this is the most crucial and the most important thing that most of the queries come to us. So we are addressing that issues now. Let's get on to the topic, Ayurveda management of infertility after IVF failure. As Dr. Priyanka told, we are an institute which is driven by protocols and have treated more than 3 lakh patients till date from the time of our inception. So let's see what is IVF. IVF basically is a assisted reproductive technology which helps to fertilize the egg outside the body and then being transferred for the growth and implantation in the uterus. So it's a specialized process wherein technology is used to retrieve the eggs from the ovary, and it is sperm is collected and it is nurtured outside the body till it attains a blastocyst stage, and then the transfer happens into the uterus and the fertility journey begins, or the pregnancy journey begins from there. So this is a specialized technique. It gives hopes to many infertile couples, but there are cases where there is failures in IVF. What are the major reasons why an IVF fails, or what are the major causes? I've just listed down few causes and we will discuss on them as we go further. The first and the foremost cause that we see why an IVF fails is because of the embryo or the implantation failure. Basically, the embryo, if we can see in the previous slide, once the embryo is inserted into the uterus, it has to go get implanted into the uterus. So the problems at implantation, it might be majorly because of 2 reasons. One is because the embryo itself being defective. That might be the defective embryo, or there can be the issues with the endometrial lining or the uterus supporting the further implantation and the growth. We'll discuss each in detail. So just understanding in simple terms. So next, as I told you, it is about the quality of the egg. The quality of the egg might major reasons for this being defective or might not be very successful is considering the age of the mother, because as the age advances, the quality of the egg reduces. That is one factor. Again, it also might be because of the quality of the sperm. The sperm might not be of very good quality, which might not support the embryo. Embryo might grow up to certain size, that is to a blastocyst stage, and then might not be able to progress if the sperm or egg or either of them are at fault. Next, coming to the next one is genetic or the chromosomal causes. This plays a major role when though the embryo is formed healthy after the pickup of the egg and the sperm. After the fertilization, the embryo is formed, but the genetic material is not having a high quality, or the chromosomal defects are seen. So these are also the major causes of the IVF failure. Next is the health of the couple. That is, if the couples are suffering from any diseases, say obesity, diabetes mellitus, or endometriosis, all this can be a hindrance in the, or PCOS can be a hindrance in the success of IVF. Also, lifestyle of the couple. This is something that I stress more in my OPD practice as well, because lifestyle and stress is one contributing factor which is under your control, which can definitely be managed easily. So these are the factors which contribute to the failure of an IVF. Is a failure of an IVF end of the story? Definitely not. It is not the end of the story. So is there something, most of my patients have a query, is there something that Ayurveda can do? Can we have a natural pregnancy after IVF? So let's understand what Ayurveda suggests and how Ayurveda helps in such conditions. Basically, in Ayurveda, we say that all these problems, what we discussed in the previous slides, can be clubbed into 4 factors. That is Rutu, Kshetra, Ambu, and Bija. This is nothing but a very simple correlation of pregnancy or implantation, embryo transfer, pregnancy, continuation of pregnancy, all to a same method of which is nothing but a farmer looking at a crop and the growth of the crop. That is where you get these terms as Rutu, Kshetra, Ambu, Bija, where Rutu means a proper seasoned ovulation and the whole process of the menstrual cycle, which is synchronized and which has a healthy outcome. Next, coming to the Kshetra. Kshetra means the whole reproductive system. That should be total health of a reproductive system. So how do we achieve it? After IVF, is there something that we can do to improve the reproductive system health? Those are the things that we will know under the Kshetra. Next is Ambu. Ambu basically means the circulation that is required. This talks about the implantation and the further continuation part. The first two we're talking about even for the proper fertilization. The next part, that is Ambu, is talking more about the implantation and the continuation of pregnancy. So this includes the blood circulation, also includes the metabolic products like glycogen, and also the hormonal support for the pregnancy and implantation. Next is the Bija. Bija is nothing but the male and the female gamete, that is the sperm and the ovum. How is the health of these two, or how the normalcy of these two, and how can we enhance the quality of the sperm and ovum? All these are put together in these 4 factors, and let's see how we will work towards achieving these 4 factors, which are very important for a conception and a healthy continuation of pregnancy. So now, what do we do? How do we handhold the patients who have had IVF failures, or patients who are looking for IVF cycle but seeking support from Ayurveda? In Ayurveda, we treat each patient as a customized protocol. It is not one protocol which fits all of them. So we design it based on the prakriti of the patient, based on what are the lifestyle of the patient, based on what are the changes that has to happen in the lifestyle of the patient, what are the diet changes, what are the Panchakarma treatment that is required for the particular condition of that patient or the particular prakriti of that patient. Based on this, a customized protocol is made for that particular couple, and we work towards achieving it. So what are the factors that we key in when we are talking about a management protocol for IVF failures or patients looking for success in IVF? So the changes that we need to bring in about is, first is the diet changes. You might ask me, why is it so important, or is it very important for us to have a diet and lifestyle changes? Yes, it is important to have a diet and lifestyle changes, because if I go back to the slides, we can see that the major causes would be the lifestyle of the patients and also the chromosomal causes. All these are basically happening because of the diet, the lifestyle, the stress level that the couples undergo during the IVF or throughout the process. All this contributes to a major role in success of fertility or the success of conception and pregnancy, continuation of pregnancy. Next, coming to the next point, that is Panchakarma procedures. So what do we do through the Panchakarma procedures? Panchakarma means 5 basic treatments that we adopt in Ayurveda. If you ask me, are all these 5 treatments done? No, not all 5 treatments are required for a fertility factor. So what we do is, certain treatments are selected particularly for the better outcome. So why is it done? The first thing is, when we are talking about, if I go back to the slide, when we are talking about the implantation failure, that is because of the endometrial health. See, most of the time patients, when they come for consultation, they tell me that, ma'am, the thickness of the endometrium was very good, but still the implantation didn't happen and the pregnancy didn't continue. So it's not only about the thickness of the endometrium that is important. It is also important to know the receptivity of the endometrium, and it is also important to know the immunological factors. So all these are very important in implantation and continuation of pregnancy as well. So these are the factors which can be helped through the Panchakarma procedure. What do we do in Panchakarma procedure is we do a total detox where the receptivity of the uterus gets better. One, the immunological factors, if they are a hindrance, are taken care of. That is where the Panchakarma procedures becomes very, very important. And also it helps in improving and enhancing the quality of the sperm and the ovum, also the chromosomal causes that can lead to failures in IVF. So that is where the Panchakarma procedures are very helpful. Not only that, when the patient is put through the Panchakarma process, there definitely, if the patient is suffering from PCOS or obesity or diabetic mellitus, there is a metabolic change that can be brought about by the Panchakarma therapies. So it is the overall development of the health. So any health issues that the couples are having is also addressed through the Panchakarma procedures. The next thing is yoga. So I would want to talk about yoga and mental health together, because yoga is not only asanas. Yes, some part of it is asana, but some part of it is also mental health. So whenever we see the patients who come to us after an IVF or 1 or 2 cycles of IVF, the psychological storm is too big. It is huge, humongous. That is the first and the foremost thing that we usually, end up tackling. More than any other factors, the first and the foremost thing would be the psychological storm that the patient comes with. So basically, we guide them through. There will be a proper counseling to the patient. The trend that I've seen in my practice is patients will come to you telling that this cycle I'm going for an embryo transfer. I have 10 days time. Can something be done? So this is where the stress levels are so high, right? And the focus is all on if it can be done, but we are not looking at what is that is led to the previous IVF failure. So we need to sit back and understand what is that is leading to the failure instead of ending up with repeated failures. So to manage the stress and also to improve the circulation and to bring about the proper circulation into the pelvic area, the asanas and the pranayamas help in doing a mental de-stress as well as in the pelvic circulation, improving the pelvic circulation and bringing about the changes that is desired. Also, some of the procedures in which we will discuss in the later slides in yoga helps in doing a de-stress and improving the mental health. Also, as complementary to some of the herbal medicines that will be used, also will complement the process of improving the endometrial as well as the egg and the sperm quality. Now, seeing what are the specific dietary advices that we can get. Most of the time, when a patient is going through IVF, obviously there's so much of focus that the patient would have understood what is healthy diet. So most of them come to us telling that I'm following a healthy diet. But let me tell you, in a family, if there are 4 people, all of you eat the same diet, but one might be suffering from one disease and the other does not. This only proves that each person's body type is specific and the food that affects your body is also specific. So a healthy diet is not a standard diet. We all don't fit into the same size of cloth, right? We have different sizes. So the same does our food also. So that is why we say that once we see the patient, the prakriti of the patient, based on the prakriti, based on what is going wrong with the patient, the food, the diet or the ahara that we suggest also keeps changing based on the condition required. But on a over general bracket, as we know, is freshly cooked food, taking food on time or not skipping the meal, and having a healthy, nutritious, wholesome food is what is advised. And definitely no to processed and aerated food, refined food products, improper timing, binge eating, or getting addicted to alcohol or tobacco. These are the things that is a strict no-no. lifestyle, does it affect fertility? Definitely, yes, it affects fertility. So what are the do's in lifestyle is yoga and relaxation, a good amount of sleep, trying to keep stress under control, and following a proper Ayurveda dinacharya. We have stipulated healthy regimens that has been advised in Ayurveda, which when it is followed helps in improving the health status. So that can be followed as well. And what are the don'ts? No late nights, because we are working with the hormones, and when the day and the night picture is changed, so does the hormonal variation happen. So whenever we are talking about the hormonal correction, having a proper sleep and no late nights would be a main complementing thing for the treatment. Sedentary life definitely is going to affect the outcomes, and also very frequent travels or long distance travels and juggling between the jobs, that these are the factors which will affect your mental status as well as affects the outcome of fertility or the IVF. Next, looking into what are the panchakarmas that can be done. So when we talk about panchakarma, as I told, there are 5 treatments, but not all 5 treatments are done here. What is done basically in infertility care or post IVF failure care is mostly we work on the digestive capacity and the metabolism. We also adopt techniques like Udvartana, which is nothing but a powder massage over the body, which helps in improving the circulation, which helps in regulating the insulin uptake, which also helps in regulating the hormonal flow, and also prepares your body for the main treatment, which is Panchakarma. Then there are treatments like Abhyanga or the oil massage. Again, I'm telling that this is not done on all the patient. It is done on case basis. What is important for that patient is adopted. But overall, these are the treatments that can be done. Then some specific local treatments into the genital tracts. As we discussed, the whole your reproductive system has to be healthy. So if any disorders are there in the reproductive system, particular treatment like yoni prakshalana. Yoni prakshalana is nothing but douching of the vaginal tract. So this might be adopted in some cases where there is need be. Coming to the proper Panchakarma procedure or the Pradhana Karma or the main treatment that is adopted, that can be Vamana or Virechana. That is, a small amount of ghee would be given before this procedure, which is a medicated ghee in an increasing dose. And once the body has attained the maximum intake, then the patient will be put on for a medicines for either loose stools or vomiting based on the case, depending on the case what it is. And also a specific treatment called as Uttar Basti and Nasya would be adopted. Nasya means installation of medicated drops into the nose. That is to see that basically how is our hormonal system stabilized for the reproduction is through our hypothalamus, pituitary and ovarian axis. So initiating a proper HPO axis is done through instilling the medicated oil into the nostrils. That is called as Nasya. And also a specified treatment called as Uttaravasti. Uttaravasti is a treatment where you can see in this picture, a medicated drug is introduced directly into the uterus. Now coming back and understanding why is it done. So we spoke about endometrial lining or the endometrial thickness or the endometrial receptivity not being complementing for the IVF. So when we are talking about endometrial receptivity, what does it mean? There is a trilaminar appearance of the uterus that should be seen for a proper transfer and continuation or the implantation and continuation of pregnancy. So here you can see there are 3 lines in the uterus. This is the appearance which says that the uterus is highly receptive at this time, and also understanding the hormonal levels. So all these are helped to improve the thickening, to improve the quality of the ovum. Also the Uttaravasti helps. So this is a particular treatment which is done immediately after the periods. It is done for 3 cycles to assure the best of the results. Usually we tell the patients that when you do the 3 cycles is when you get the maximum results. But we have seen in some patients even 1 cycle of Uttarabasti has given us better results. So that's how it helps. So also some of the other treatments that can be used in infertility treatment after the Panchakarma treatment is Shirodhara and Yoni Pichu. Shirodhara basically helps the patient in having a de-stress of the total system, and also mentally and physically relaxes the patient and makes them very receptive for the treatment. Now talking about the yoga. In yoga, there are two parameters that we adopt, that is pranayama and asanas. Pranayamas, there are certain pranayamas which helps the patient to regulate the breathing and thereby also regulate the bodily humor, as well as also become help themselves to de-stress. And also particular asanas like Gomukhasana or Utkata Konasana, butterfly, Bhujangasana, Thadasana. All these asanas are very, very helpful in reassuring the pelvic circulation and also bringing in the changes what we are looking at the endometrial level. Next is about the dravyas. What are is that all? Is Panchakarma the end of the story? No. Along with that, we after the total detox, there is nourishment required for the body to have a healthy pregnancy, continuation of healthy pregnancy. That is when the internal medication come in to help, in terms of, it can be in terms of tablets, in terms of ghee or powder or kashayam, or in form of lehya. This will be decided on what is the pre-existing condition, whether it is to enhance the ovum quality or whether it is to enhance the sperm quality. So basically it depends on what is the factor that is affecting, and that will be helped through some oral medication. So when we are talking about the treatments of Panchakarma, this is not only for the female but also for the male if there are sperm factors which are contributing to the failure of IVF. Next is about mental health. How do we help the patient or handhold the patient to improve the mental health or de-stress? So first, as I already mentioned, is counseling, proper counseling to the patient, making the patient understand what is the situation, how do we work on it, and what are we looking at, what are the outcomes that we are looking at, and how it can be achieved. Next is some procedures which will help the patient. I always tell my patient that it is easier said than done. If I tell them that, okay, de-stress, it is not going to work out easily. So we give them some procedures which will help them to de-stress. One among that is Trataka. Also, there are some relaxation techniques called as QRT or DRT, and also music therapy. There are certain research papers which support that music therapy helps in de-stressing. So there are certain chants or musics that we advise the patient which they can follow to de-stress themselves. So these are the basic protocols that we follow and work towards the outcome in the patient. Thank you.
Thank you for the wonderful presentation, Dr. Swetha. If you don't mind, can we start with the question answers? I've got plenty of questions coming on to me.
Definitely, Dr. Priyanka, definitely. Let's go ahead and look into what are the questions.
Others, attendees, please put your questions in the Q&A section, and I can take your questions as well. I will start with a few questions, those who had asked during the session. Ma'am, can I begin with the first question?
Please go ahead. Go ahead, Dr. Priyanka.
So someone is asking, can Panchakarma help with IVF failures? What are the main Panchakarma procedures?
Yeah, so definitely Panchakarma can help even before patient is opting for IVF to do a total detox, as I told you, to improve the health as well as to improve the quality of the sperm and ovum and improve the quality of the endometrial layer. So this will help but if the patient has already undergone the IVF and there is a failure, even then this can help for the next planning what the patient can do for the fertility. So Panchakarma can be adopted. What are the Panchakarmas that is adopted? In most of the cases, it is either Vamana or Virechana, that is medicines to induce loose stool or medicines to induce vomiting. That is the first procedure that is adopted, and that will be decided based on the nature of the condition or the body type of the patient, and what are the reasons which has led to IVF failure. Before that procedure, a medicated ghee is given to the patient in an increasing dose. This is called as Snehapana. So the first procedure is Snehapana, followed by Vamana or Virechana. And the next thing is, in most of the patient, a Basti procedure is also done. Basti can be either there can be oil enema, which is called as Matra Basti, or a decoction enema, which is called as Kashaya Basti. This is specific to certain conditions, but the major treatment that is usually adopted in infertility management is called as Uttar Basti and Nastya, where Nastya is instilling of medicated substance into the nostrils. As I told you, it helps in the HPO axis because everything starts from the hypothalamus. Hypothalamus is the initiator for our hormonal orchestra. So if the ovaries has to function well, and ovaries has to take care of the uterus, the whole functioning starts at the hypothalamus. So that is where we start the treatment with the Nastya, which is the entrance door for our brain and the connected neural as well as the hormonal pathway. So it starts with, there is a procedure called as Nastya, where we instill medication into the nose to improve the outcomes. The next procedure is called as Uttaravasti, where a medicated substance is introduced into the uterus. It is a very specialized technique which is done under proper aseptic precautions, that is which is done in a proper infection control room with all the aseptic procedures, where a medicated substance is introduced into the uterus. So we have seen many cases, Dr. Priyanka, where the patient had defects in trilaminar appearance, or the patient's PI index of the uterine arteries are not very helpful. So before and after, we have seen a very good results in all these areas when Uttaravasti is done, and very promising results in outcomes of IVF as well when Uttaravasti is done.
All right.
I hope
all
that
right.
answers the question.
Yes, definitely. There's another question. Someone's asking if they could conceive naturally after multiple IVF failures.
That is natural conception after IVF failure. Okay. This is the area where, in many cases, IVF is opted as a last resort, right? But in some cases, IVF is opted because of the lifestyle of the patient or because of many other factors. So it depends what was the cause for IVF failure. It also depends on what is the health status. But to be optimistic, I can tell you that there are some patients who have conceived naturally after an IVF failure, which is without any IVF, with Ayurveda procedures, with the Panchakarma and proper following of diet and lifestyle, they have conceived naturally also. So it is not a definitive yes or no answer, but it depends on the condition, what has led to an IVF failure. But definitely there are patients who have conceived naturally after an IVF failure.
Great, ma'am. That's really reassuring to those who have been asking the questions here in the chat box. There's another question with someone asking PCOS with AMH level 20. So can you talk about AMH levels and associated comorbidities just like PCOS or diabetes, something like that?
So AMH is an important factor which tells us what is the reserve of ovarian follicle that we have and what is the quality of the ovarian follicles we have. So, in many conditions, this is affected. So if you see in case of PCOS, the AMH might be very high. That is because there are multiple follicles, and that is why the AMH level is high. That doesn't mean that it is good for fertility. Okay. So in some cases, you might see that the AMH level is very low. It again is not good for fertility. So having an optimal AMH level is what is required for fertility or even for IVF process. So in PCOS or in any conditions where the AMH is affected, definitely there are procedures in Ayurveda what helps to improve the AMH levels. And basically, it is again going through the same channels of management or the same protocols of management. First is putting the patient to Panchakarma, and then oral medication is the way to go in AMH correction, and also in PCOS patients affected with AMH levels. This is what we have seen giving us promising results.
All right. Thank you, ma'am. The next question is, what are the steps to diagnose which treatment module will be suitable for which patient? So are blood reports and history, etc., are the first step for it?
Yeah. So see, we work with the pattern where we have our own diagnosis protocol. Okay, at Ayurveda we decide the prakriti of the patient. We decide at what levels are the disease condition, at what we say at Shroto Doshti level. We have our own classical Ayurvedic understanding of a disease, complemented with all the diagnostic availability of all the diagnostic tests. Like we also look into the blood tests, we look into the sonology or the follicular study, we also look into the, as I told you, the endometrial receptivity assays, ERAs. We also work with PI indexes, Doppler studies of the uterus. So all these factors will be considered. We do a before and after test to assure the patient what is the result that we have gotten. So this is the protocol that we follow, that there is a proper Ayurveda diagnosis that is happening, because the mode of working on the patient will be through Ayurveda. Management protocol will be through Ayurveda. So along with that, we also refer to all the lab investigations which are required to understand why did the patient end up in having a failure.
Right.
Because most of the time, if we don't look into the modern diagnostic tools, it might not give us 100% results. Definitely, there are areas which contributes to our outcomes. Looking at the proper diagnostic tools like endometrial receptive assays, all this helps to a great extent when we are looking at the outcomes.
Right, ma'am.
So the immunological assays, because we cannot be working in isolation, not addressing that sometimes becomes the major reason for implantation failure and continuation of pregnancy.
Right. Ma'am, another question from someone is asking about Purva Karma. You were talking about Purva Karma, so could you explain a bit in detail?
Yeah, so Purva Karma, in classical terms of Ayurveda, it means preparing the body or the patient for the main treatment, which is the Panchakarma, like Vamana, Virechana, Basti, or Natya, or Rakta Mokshana. But in my slides, I've written certain things like Yoni Prakshalana, which might not fall classically into the Purva Karma category. But in the treatment of infertility, we call them as Purva Karmas. That is because if a patient is having a chronic PID, right? So if I'm planning for Uttar Basti in that patient, without a Yoni Prakshalana and clearing that PID, I cannot go for the Pradhana Karma, which is my Uttar Basti. So that is why Yoni Prakshalana has been taken in that category of Purva Karma. But basically, Purva Karma means preparing the body for the major treatment. So where Udvarthana, Abhyanga, or methods like Agni Deepana or internal medications to improve the metabolism and digestion of the patient. These are all the Purva Karmas that is adopted when we are treating an infertility patient, irrespective of male or female.
Right. Great. So another question, like you said, irrespective of male and female, someone's asking how important is the role of patient's partner in treatment of fertility issues?
So see, if this question was asked some 10-15 years, I think there was a big taboo. But now I don't think that is the case. Most of the patients are open to understand what is required from both the partners in terms of investigation, in terms of treatment, what is required. So definitely, if the cause for IVF failure or if the cause for infertility is a male factor, then definitely the contribution of the male is also as much important. But even if the factor is only female factor affecting the fertility, then also emotionally the partners being together in the journey is very, very important, because as we are talking about infertility IVF failures, both the couples are going through a huge amount of emotional drain, physical drain, financial drain. There's a lot of things involved when a couple is going through a infertility management. So definitely both partners being complementing each other, may it be in diagnosis, may it be in treatment, may it be in being an emotional support, is definitely very, very important.
Yes, definitely, 100% agree to that. So another question is about diagnostic parameters required for enhancing implantation other than routine diagnostic tests.
Dr. Priyanka, can you come again? There was some disturbance. I could not hear your question clearly.
Right. Someone is asking for advanced diagnostic parameters other than the regular diagnostic tests required for enhancing implantation.
Okay.
So which are the tests needed? Yeah.
Okay. So first is we need to understand the reason for failure. So it would be important to get a biopsy of the embryo or the sperm and the ovum to understand what is the quality, whether there is any chromosomal defects, whether there is any genetic defects. Karyotyping is very, very important. One. Second thing is coming to the endometrial health. So knowing the endometrial health can be done to the Doppler studies to understand the PI index or the index of the uterine arteries. Next is about the ERA, which is the endometrial receptivity assay, to understand what is the progesterone levels and what is the good time for nidation, what is the good time for growth. All this can be understood through the ERA. So these are certain tests. Immunological tests also are very important to understand what are the hindering factors for implantation, whether the mother's body is rejecting the fertilized blastocysts. All these are the advanced investigations that will be helpful, along with the routine investigations that has been done for infertility management.
Right, ma'am. Talking about Uttar Basti, there is a question about Uttar Basti. Will it help to clear the blocked fallopian tubes? So that is tubal blockage also is one of the reasons you mentioned.
Yeah, so tubal blockage is one of the reasons for infertility. So does Uttar Basti help, if you ask me, if does Uttar Basti help in relieving the tubal blocks? Definitely yes. The medicines that we use in clearing in cases of tubal block is entirely different from the medicines that we use to enhance the endometrial health. But in tubal block cases, it depends on what is the extent of the block. Where exactly is the block? Is it at the fimbrial end? Is it throughout the salpinx, or that is throughout the tubes, or at what extent is the blockage? And also this requires multiple sitting, not one sitting of Uttar Basti or two sitting of Uttar Basti. If the blockage is very less and if it is the fimbrial end, then it can be helped in 2 or 3 sittings. In some cases where the blockage is severe, in those cases it might require more sittings of Uttar Basti, but definitely we have seen results in tubal block cases.
Right. All right, ma'am. So talking about Panchakarma, someone is asking, can Panchakarma therapy be done at home?
So Panchakarma is a very specialized procedure which needs supervision of an expert. Okay. So these procedures are guided by a doctor and is supervised by a doctor on a daily basis when it is done. So it is always advised that it is done under the supervision of a doctor in a hospital setup. So when I say hospital setup, you need not be admitted there throughout the procedure. There are procedures which needs the whole day monitoring. Only then is when you are required to be hospitalized. But there are procedures which is hardly 20 minutes, some procedure which is hardly 45 minutes. So you can walk in, get the treatment done under the supervision of a doctor through the expert caregivers, and then be back in your home setting. It is not that you have to be admitted throughout the process of your treatment. But yes, it has to be done under the supervision of an expert through the properly trained caregivers.
Thank you for the clarification, ma'am. I hope those who have asked this got clarity about this topic. Also, following that, there is a question about Nithyavirichen and infertility. In cases where Virichan or Panchakarma is not feasible, so what would you say about Nithyavirichen?
See, Nithyavirichen means giving medicines to a patient where we achieve some amount of loose stools in the patient on a daily basis for certain duration of time. So if you ask me, does this help 100%? When we are treating infertility, in some cases, it might not help us to 100%. We might not achieve a desired result, because basically there are two main categories of treatment what we are working at. One is Shamana and one is Shodhana. If we are looking at a Shamana, whereas just subsiding the imbalance that has happened, then this Nitya Virechana might help to a very milder form of outcome. But if we are looking at a proper Shodhana to the patient, then Nitya Virechana might not be the solution that we are looking at.
Right. All right, now. Another question: can Ayurveda treatment be taken along ongoing IVF treatment?
Yes. So Ayurveda treatment can be taken before IVF, during IVF, post IVF. Either it is a failure or a success. Even if the IVF has become a success, to continue with the pregnancy, uninterrupted, uneventful pregnancy, if couples are desiring for, then Ayurveda can even contribute and help there to continue the pregnancy with some of the oral medication. Okay, so let me talk about before IVF. Before IVF, if a patient had a previous IVF failure and is planning for the next IVF, I would urge such patients to give themselves some time, undergo a Panchakarma procedure, do a proper Shodhana, improve their chances of fertility, and enhance the quality of the sperm and ovum, enhance the quality of the uterus, and then plan for IVF. That is one thing. That is before planning your second or third or whatever number of IVF that is. The second thing is during the IVF. During the IVF, yes, because when the patient has gone for an egg retrieval, they would be going through a lot of hormonal, oral hormones, injectables, and so many other things. So that is the time when Ayurveda can also contribute to improve the quality of the ovum and also help in getting out the best quality of the ovum for the egg retrieval. That is at the egg retrieval time. Next is before the transfer. Can Ayurveda do something to improve the quality of the endometrium, to improve the quality of the endometrium so that it becomes very, very receptive for the transfer that has been planned? So once the blastocyst attains, when the embryo attains such stage of blastocyst, it will be planned to be transferred into the uterus. So improving the quality of the endometrium can be achieved through some Ayurveda drugs. Internal medications, oral medications can help in improving this stage. So next, coming to the post-IVF. Now that the transfer is done, we can support the body in terms of having the proper ambu or the proper circulation of hormones as well as the blood circulation to help in continuation of pregnancy and proper implantation. So all stages of IVF, patient can continue with Ayurveda medicines safely. And we have worked with several patients who are going through IVF through Ayurveda medicines, complementing the success of IVF. Also, throughout the pregnancy, patient can continue with Ayurveda medication to assure that the pregnancy meets all the requirements and also goes till term being uneventful.
Thank you for explaining that in great detail, ma'am. Another question. So are there any strict restrictions during the Ayurveda infertility treatment?
As I told you, where we stand today in terms of a reason for infertility or reason for failure of infertility, our body is nothing but the diet and lifestyle that we put the body through. So a small correction in diet and lifestyle is definitely there, which is the major factor that will help in the success. Okay. So it is not that the patient is put on a strict diet, which it is not possible for the patient to follow. That's not the case. But definitely regulating the diet as per the requirement of the patient and regulating the diet as per the requirement of the outcome that we are looking at is there. Changes in lifestyle is there, because stress and lifestyle is also a major contributing factor for the fertility failures or the IVF failures. So there is a modest way, I would say there is a modest changes in diet and lifestyle that would be required for a healthy outcome in a fertility management.
Sure. There's, I think, someone's typing another question. In the meantime, I would like to ask you about mental health. So you discussed about mental health and how it affects fertility, how it affects the outcomes of IVF. So could you also explain that how does Ayurveda help to cope with mental health issues due to multiple IVF failures or in general due to infertility?
Yeah. So, see, the whole procedure of IVF is a lot of, too much of emotional and stressful phase for both the couples. So, when we say that it has failed, definitely there is a load of psychological storm that the patient is going through internally. And when they come to us, that is the first area that we help them to cope with. And how do we do that? As I told you, there are, it's easier for us to tell that you need to de-stress. What are the ways that we can help the patient to de-stress is something that we adopt in Ayurveda. We counsel the patients, which addresses all the concerns that they have, which addresses the emotional the emotional changes. It addresses all the concerns basically that the patient have. First thing. Second, we give them proper yoga and the pranayama, which helps them automatically puts them into a routine and thereby relaxes them mentally. Then, as I told you, the procedure called Trataka. Trataka, there have been researchers held on Trataka, which shows that it helps a lot of mental de-stressing as well as reducing the stress levels in the patient. And as I told you, there are techniques called as a quick relaxation technique and deep relaxation technique, which helps in de-stressing the patient. And also some of the procedures, as I told you, Shirodhara, it helps in de-stressing the patient. So these are the methods that we adopt to help the patient cope stress during the infertility management and also during the IVF.
All right, ma'am. So there is another question here talking about how Ayurveda, or just 1 minute, I'll just read on the question here. It is a long question. Could you please comment on the current trend today applicable to those who are going in for IVF treatments? Is it only older couples or even younger couples being compelled to go for IVF? If this is true, then what are the reasons for young couples not being able to conceive? What would you recommend for younger couples to keep in mind to plan for a successful natural conception?
Yeah, as I told you, see, if we see 10 years back, the people seeking IVF would be people who are above 35 years of age, the couples who are above 35 years of age, or so on, or 30 years of age, or so on. Or people who have multiple concerns ending up in infertility. But if you see today's life, because of the lifestyle, because of the many factors, it is not only the what I would say physical factors or the diagnostic reasons why couples are opting for infertility. There are many couples who opt for IVF management. So there are, now we can see a trend where it is even younger couples opting for IVF treatments, thinking that it is easier one, and they don't want to delay the process and then end up in a lot of trouble. So these are the multiple reasons. There can be a number of reasons why people are opting for IVF these days in early age. So even not getting in there, because that's a total different scenario. What I would like to say to younger couple who are opting in IVF is, give yourself a chance to undergo Panchakarma treatment. See what are your chances of improving your fertility through the Panchakarma process, and enhance the body. What I would say is, enhance the chances of your body to conceive naturally before even you try for IVF. Because going through a Panchakarma process will not only improve your chances of fertility, but also will bring about health and metabolic changes that you're looking at. It's a overall health. Also improves the chances for fertility with the big improvement in chances. So give yourself a chance to undergo Panchakarma treatment first before you plan IVF, because also I would say it becomes easier to work with couples who has not undergone through IVF procedure for improving fertility before they undergo any other IVF procedure.
Right, ma'am. That was actually really insightful, and I'm sure that we have covered almost all the questions that were asked. And if there are any more questions, please do type in here. But I suppose we have covered all the questions, and you have highlighted all the major points. I mean, you have highlighted all the factors that are responsible for IVF failures. You have also highlighted what does Ayurveda do and how we can get optimum results, optimum benefits with Ayurveda treatment. And I'm sure those who have asked a lot of questions related to their personal queries here as well, even they could get benefited from this. It was really insightful, ma'am. Thank you so much for your presentation and your session. I would request all the participants who have been posting some personal questions here as well to avail one free consultation, one complimentary consultation with Dr. Swetha. And you can ask her all those questions. You can show her reports. You can tell her everything about your health issues, and you can get your queries resolved by Dr. Swetha herself. So I think that would be one of the things that you all can definitely plan after the webinar. Dr. Swetha, there's one last question which I would like to take, and then we can conclude.
Yes.
The question is, how does integrative infertility management work?
So, as I told you, isolated, no, if a patient is only choosing one system of medicine, there are certain benefits of that. But when we complement the systems, that is, when two systems of IVF and Ayurveda are combined, or we integrate the practice of helping the couples through infertility management, including Ayurveda treatment as well as IVF treatment, that is when we've seen that the results are maximum. Because in some patients, there might be some genuine reasons where the fertility is a cause, or is at a problem, or fertility is very difficult in certain patients because of some genuine reasons, like say tubal block. So a tubal block where there is a very severe degree of tubal block and the patency of both the tubes are absolutely zero. So in those, and the age of the patient is also advancing. In such cases, we don't have enough time to see that the tube patency is achieved. In such cases, if we can improve the quality of the sperm and the ovum and improve the health of the uterus, and patient undergoes IVF along with some Ayurveda treatment, which will enhance the chances of fertility more, or the conception and pregnancy, continuation of pregnancy more. In such cases, I think integrative management is the option to go. There are so many other cases. I'm just taking one example. In such cases, it is the best option that a patient can avail for the management.
All right, ma'am. So those who have attended, I'm just telling you all about Dr. Swetha. Dr. Swetha is working at Aster CMI Hospital, Ayurved Aster CMI, and which is an integrative fertility center as well, where Dr. Swetha is treating infertility patients which were referred to her also from the allopathy doctors. So that is how the integrative treatment is going on with for patients. And there is also a question regarding that. Please comment on specialists from two systems that work together, which you have already been doing at Aster. So would you like to comment on that, Dr. Swetha? Ma'am, you're not audible.
In gynecology, in our center at Aster, from Ayurveda, we are an Ayurveda unit which is functioning inside the Aster Hospital, where we integrative management is done at different department levels. In nephrology, in neurology, in oncology, in PMR department. But if I have to talk specifically in gynecology department, where I work closely with the doctors from gynecology department, we integrate in menstrual disturbance, areas like menstrual disturbance. We integrate in areas like pregnancy, high risk pregnancy, where both Ayurveda and allopathy can help integrative care for the patient. We integrate in cases like PCOS, endometriosis. We also integrate in infertility management and IVF care. So these are the major areas. Also antenatal care, postnatal care, multiple areas. We are complementing each other, and we have seen that there are better results when we have an integrated management of the cases in gynecology and obstetric as well. Both the areas have given us promising results where we are working together.
Great. So I think that covers all our questions. And if there are any more questions, any further questions, do reach out to us. I have also shared the contact number where you can book your appointment and avail your free consultation with Dr. Swetha. With this, I would like to thank you, Dr. Swetha, for your wonderful, informative, insightful session on Ayurveda management of infertility after IVF.
Dr. Priyanka.
Yes, ma'am. This was really insightful, and we thank you for your time as well as your presentation.
Thank you. I would like to thank Ayurveda and everybody at Ayurveda for giving me this opportunity, and also to the audience who came up with really good questions. And it was a very interactive and a very good session. I personally liked it. Thank you so much, Dr. Priyanka, and thank you everybody at Ayurveda for organizing this webinar.
Thank you, ma'am. On behalf of Team Ayurveda, I thank you one more time for spending this insightful hour with us. And the audience, please avail your consultation with Dr. Swetha as soon as possible. All right. Thank you. Thank you so much. Thank you everyone for joining in. Have a pleasant day.